Today, let's talk about breast reconstruction. If you or your family member is a breast cancer patient and are seriously considering breast reconstruction surgery, then probably you have a lot of your questions answered here. So we will discuss about what is breast reconstruction, why breast reconstruction surgery is indicated, what are the types of breast cancer surgery, thereby what are the types of breast reconstruction surgery, when to undergo breast reconstruction, and how is the recovery pattern from breast reconstruction. So breast reconstruction surgery is done when the breast is removed in part or completely in order to clear the cancer. When a woman suffers from cancer, depending on the size of the tumor and the ratio with the size of her breast, the cancer surgeon or the oncosurgeon determines whether the patient will benefit with a breast conserving surgery or a complete breast removal surgery. In breast conserving surgery, only the tumor with surrounding normal tissue is removed, such that most of the breast tissue is left behind. There are many specifications based on which the cancer surgeon will determine if the patient is a suitable candidate for breast conserving surgery. In breast conserving surgery, reconstruction is done essentially to restore the lost volume of the breast once the tumor is removed. In patients having a very large tumor or extensive tumor or tumor spreading to the axilla, they need a complete removal of the breast. In such cases, breast reconstruction is done using tissues from other parts of the body. This breast reconstruction surgery is done by a plastic surgeon with the intention to restore femininity in the female patient. So to reiterate, what is breast reconstruction? Breast reconstruction is a surgical procedure that aims to rebuild one or both the breasts after a mastectomy or a lumpectomy. It is a technique to restore a woman's breast shape, size, and symmetry after breast cancer surgery. Now, why does a woman want a breast reconstruction surgery? Breast reconstruction is often performed to restore the appearance of one or both the breasts after a mastectomy or a lumpectomy, which these surgeries are commonly performed for breast cancer treatment. Losing a breast can be a traumatic experience for many women, and hence breast reconstruction will help them to feel more comfortable with their bodies and regain their self-confidence. So it essentially restores femininity in a woman, and thereby a woman feels complete with a breast reconstruction surgery. The awareness of breast reconstruction in India is extremely poor, and most women do not know that such an option is available. Hence they feel there's a period of a very low phase once a woman undergoes a mastectomy. With the help of plastic surgery and now microsurgery, remarkable breast reconstructive surgeries can be done, giving a very good appearance so as to restore the look of a woman to the preoperative levels. So based on the type of the breast cancer surgery, the breast reconstruction is planned. In women who can undergo breast conserving surgery, we need only to restore the volume that is lost. So this is done by using local flaps from the adjacent area, which includes tissue in and around the breast and the chest wall area. For women who undergo a modified radical mastectomy or a complete removal of the breast, they need a larger volume of tissue which is equal to the opposite normal breast to reconstruct the entire breast which is removed. In this case, we take this large volume of tissue either from the abdomen or from the thigh, depending on the size of the woman's breasts. So to reiterate, the options for breast reconstruction surgery are using local flaps or distant flaps. Local flaps are tissues from around the chest wall area, while distant flaps are using tissue from the abdomen or from the thigh in case of a huge breast reconstruction. However, if the woman's breasts are small, then tissue from the lateral chest wall or from the back can be used to reconstruct the breast. Now there is another method of breast reconstruction, which is the implant-based method. In this, a silicone implant is used to reconstruct the breast, but a muscle flap or flap from the back needs to be used to cover the implant so that it does not get exposed during radiation. In the present scenario, assessing the merits and demerits, flap-based reconstruction, that is using tissue from the woman's abdomen, is a far superior surgical method, giving very good aesthetic results and a good match with the opposite normal breast. Now, when to undergo breast reconstruction is another important question to consider. Breast reconstruction is ideally done at the time of the primary breast cancer surgery. This is called a primary breast reconstruction. In this case, the entire removal of cancer and reconstruction of the breast can be done in the same surgery in a single anesthesia duration. The second form of reconstruction is called secondary breast reconstruction, which is done about 6 months to 1 year after completion of the cancer treatment. That is, mastectomy with chemotherapy or radiotherapy as indicated, and after a gap of 6 to 8 months or 1 year, the woman comes back to undergo a breast reconstruction. Problem with the second method is that it requires double admission, double surgery, and double anesthesia duration. Apart from the fact that for almost a year, the woman has to be without a breast, which can greatly impact her psychology. Recovery from breast reconstruction is about 2 to 3 weeks for all the suture lines to become dry, and subsequently the patient will undergo chemotherapy and radiation therapy as indicated. The area from where the tissue is taken for breast reconstruction, that is either the abdomen or the thigh, also heals up in the same amount of time. There will be drains which will be placed in the chest wall area and in the abdomen, which usually come out in a week's time. The patient is up and about from the 3rd or 4th day and usually discharged within a week's time. So this in brief was about breast reconstruction and its importance on how it can impact femininity.